After you recover from COVID-19, your symptoms may not just disappear. Many patients are reporting side effects lasting much longer. And we're not just talking about your lungs. Janelle Bluda connects the dots.
We are learning more about the long-term health effects of a coronavirus diagnosis, and doctors are warning even people with mild cases to be on the lookout for signs they have not fully recovered. Let's connect the dots. When COVID-19 first hit, it was mainly thought of as a respiratory disease, but now we know the virus also goes after the digestive tract, heart, kidney, even the brain. And that is why we are seeing more symptoms than just a fever and a cough. The ever-expanding list now includes everything from vomiting to the loss of senses like taste and smell. After beating back a virus, your immune system should get to work repairing any damage done to organs. But what doctors are finding is that days after the virus has cleared a patient's system, they are still reporting debilitating exhaustion, problems with motor skills, and even blood clots. One of the bigger concerns is brain damage. A small study in Britain found neurological complications in some coronavirus patients, though more research is needed. And that's part of the problem. Since this is a new virus, we just don't know for sure what the long-term effects will be, but support groups are popping up online with thousands of members, all people who say they're dealing with lingering symptoms weeks and even months after diagnosis, a reminder that there's still a lot we don't know about COVID-19. Connecting the dots, I'm Janelle Bluda for H-Town Rush.